November is Early Childhood Mental Health Awareness Month, a time set aside to talk about mental health in those formative years. Dr. Scott Cyrus is a pediatrician, and we have him on each month. He's joining us this morning to talk about some of the signs to look for in our youngest patients. Good morning. It's great to see you.
Thank you. Thank you for having me on.
When we talk about early childhood, what ages are we referring to?
You know, we're really referring from infancy all the way up through preschool.
How important are those early connections, mother-baby bonding times? So often moms have to maybe go right back to work, and then the caregivers change. Talk to us a little bit about that.
You know, when you think about infancy through preschool, there is a lot of things going on at that point in time, especially in the growth of the brain. The growth of the brain is doubling, if not tripling, by about 5 years of age. So a lot of connections are being made in that kind of safety, that security, stability aspect of their world. And so our responsibility as parents would be to make sure that environment, that home environment, or if you, like you said, has to go to daycare or another caregiver, that environment has to be very, very secure, safe, and stable, and that helps the child grow.
As you see babies and toddlers coming to you on maybe an annual basis, what are some of the signs and symptoms that a parent might observe in between the time that you get to visit with them?
You know, yeah, what we see is that aggression. A lot of times we'll see behavior that's kind of out of bounds, as I call it, for what the response is. A major temper tantrum over something small, like let's go eat or something like this. Aggressive behavior, things like throwing toys, or people will say, well, is aggressive behavior biting? Usually biting is more of a frustration of behavior, and so not so much as a aggressive behavior. But you see them changing their sleep patterns and having complaints of physical illness. Poor social interactions. Many times you'll have children that are very, like I said, aggressive, angered all of the time, and you wonder what's going on.
Sometimes it's hard, though, to tell, what is kind of normal behavior and what would be considered more of a sign and pay attention.
That's a great question, because everybody has their kind of barometer, if you will, for that actual situation. If you feel like your child's behavior is out of bounds, as I like to say, for a certain situation, definitely want to talk to your physician about that. There's early key factors that you really want to look at. And of course, treatment is focused on early intervention.
Well, and let's talk a little bit about some of the parent caregiver tips. What are some of the things that you're suggesting to help parents or caregivers when they're dealing with a little one?
Well, like I said, early intervention is key, and so take time to observe your child. If there are issues with your child's behavior that you're concerned with, be sure and talk with your physician, your pediatrician. Always think about being affectionate, hugs, give them a safe, nurturing environment. Interact with your children, read to them, talk to them, even though they can't really talk back to you, especially in infancy and early on. That's how they learn their vocabulary. And support your child's developing skills. So try to understand, what does a 2-month-old or a 6-month-old or a 3-year-old do as far as they're developing, and try to help develop that. And look at your experiences, giving their relationship with other people. Make sure that they have very supporting, loving, nurturing type of relationships. And also think about as your child starts to interact with the world, understanding their culture, but also understanding the cultures of other people that they may run into.
Sure, those differences are important, and oftentimes conversation at home will help them when they're out in the social world. Dr. Cyrus, as always, we appreciate your time. We look forward to seeing you in December. Happy Thanksgiving to you and your family.
Happy Thanksgiving to all.